Hi, I am Dr. Vishwanath and today we are discussing regarding SVC type of ASD. Before starting the SVC type of ASD, let us see what are the various types of ASDs. See, there are four types of ASDs, or else we can say it as five types. Secondum ASD, these cases are 75% of cases will be secondum type of ASD. Ostium primum type of ASD will be 20% of cases, and sinus venous ASD, it is divided into two: superior Venacaval ASD and inferior Venacaval type of sinus venous ASD. If the defect is towards the superior vena cava, it is called as SVC type of ASD. If it is near the IVC type of sinus venous ASD. And there is another type called as coronary sinus ASD. This is the coronary sinus type of ASD. There is a defect around the coronary sinus. So these are the four types of ASDs: ostium secundum type, ostium primum type, SVC, either SVC type of sinus venosus ASD, IVC type of sinus venosus ASD, and coronary sinus ASD. Only 5% of cases are sinus venosus ASD. In that also, SVC type is more common than IVC type. And here you can clearly see this is the transesophageal echo showing the bicaval view. Here bicaval view is taken at 90-degree angle and at mid-esophageal level. Here it is SVC and this is left atrium, this is right atrium. In color Doppler, it is clearly demonstrating there is a left to right shunt across the ASD. This is the blood flowing through LA to RA, left atrium to right atrium, across the defect. Okay, and this is the transesophageal echo clearly demonstrating the defect. So the defect is very difficult to detect in transthoracic echo, especially sinus venosus type of SVC type of ASD. It is very difficult to detect in transthoracic echo, and the main diagnostic modality for the definitive modality is transesophageal echo, which it shows clearly the defect. There is a deficit of the SVC rim of the ASD. Here the in SVC type of ASD, there is a veno-atrial connection of both SVC and pulmonary vein in continuity with both atrial walls. It is this SVC is connecting both to the LA left atrium and right atrium across the defect through the defect. The tissue separating the SVC and right upper pulmonary vein is deficit and results in unroofing of the pulmonary vein. So, posterior wall of the right superior vena cava and anterior wall of the right upper pulmonary vein are deficit. Why I am mentioning specifically right SVC is sometimes possibility of left SVC is there. That's why in SVC type of ASD, the right SVC and right upper pulmonary vein, the wall between them is deficit, creating a SVC type of ASD and also leading to partial anomalous pulmonary venous connection to the right atrium across the defect from right upper pulmonary vein. And this is the like echo picture, transesophageal echo picture of bicaval view. As I mentioned, in bicaval view taken at 90-degree, showing the this is the SVC and this is IVC, and superior part is left atrium and here it is the right atrium. So here you can clearly see in color Doppler the blood is going from left atrium to right atrium across the superior SVC type of ASD, and there is a turbulence due to right upper pulmonary vein is anomalously draining, so it is causing the turbulence over there. And here you can see this is the interatrial septum, but there is a lack of continuity towards the SVC. This is causing the defect. This is called as SVC type of ASD. The main modality of treatment after this procedure is either surgical closure or covered stent closure, depending upon the surgery, cath studies and rims and efficiency of the surgery. Thank you for watching.